All right, we've gone over a few anxiety disorders. Now it's time to talk about generalized anxiety disorder, or GAD. Now, this is anxiety that's not linked to anything specific. Basically, people who have it will often say, I worry about anything and everything. So this is uncontrollable worry and other cognitive and physiological symptoms. When you test people, if you're looking for a diagnosis of generalized anxiety disorder, you ask about feeling anxiety, feeling worry about a variety of situations. It's constant, it's all the time. Sometimes people will mistakenly think that generalized anxiety disorder is just a label you give to somebody who shows anxiety and you can't put it in one of the other categories. No, this is its own unique experience. This is someone whose normal everyday life is characterized by anxiety. They don't know what it's like not to worry, essentially. And this does cause problems for the person, right? So generalized anxiety disorder, it may not be linked to something specific like what you have with specific phobia, but it is impairing and it does interfere with quality of life for that person. Now, in addition to GAD, we have some other disorders to cover regarding anxiety disorders. Now, the next one that I'm going to go over is one that there's some misperceptions out there about it and misuse of the wording and whatnot. So the next one that we're going to talk about is obsessive compulsive disorder, often abbreviated OCD. I can't tell you how many times I hear people who do not have OCD say things like, I'm so OCD. All right, so there are problems with the word usage right away. So with OCD, this does not just mean you're a very neat person or you like things orderly. All right, you can be very neurotic or just like orderliness and not have OCD. So obsessive compulsive disorder, not surprisingly, involves obsessions and compulsions. So we're going to have to define those things. So what's an obsession? An obsession is an intrusive thought, a thought you can't get out of your head. You can't just brush it away. So a person with OCD, they have these obsessions, these thoughts that sneak in and they bother them. All right, these are upsetting, intrusive thoughts. So these are repeated and uncontrollable thoughts, images, or urges. So it could just be a thought that won't go away. It could be an image you can't get out of your head, sometimes a very upsetting image, sometimes just a nuisance image. And also ideas like you should do something, like you should touch that spot on the wall. You should go wash your hands. I mean, there are various thoughts that you might have about actions. And sometimes these thoughts can lead to compulsions. Compulsions, compulsive behavior, these are behaviors that you feel like you must do. You feel like you have to do them. So these are repetitive and ritualistic behaviors. And there are many different ways that someone could exhibit obsessive compulsive disorder. But they might have something where when they leave a room, they have to tap the wall 5 times, exactly 5 times. If you try to get them to explain why 5, they're like, I cannot, but that's my reality. That's my situation. Why do they have to tap it 5 times? Possibly because they have an obsession that's saying you got to do it 5 times. Bad things may happen if you don't do that 5 times. And sometimes I'll have students, when I explain stuff like that, makes no sense. No, it doesn't make sense to you because you clearly don't have OCD. To someone who has OCD, yeah, this makes sense, all right? Your brain is not working the same as someone, your experience is not the same as someone who has a clinically significant OCD. Is it possible to have obsessions without compulsions? Yes. Is it possible to have compulsions without obsessions, without recognizable obsessions? Yes. So OCD involves both. Someone who has these obsessions and these compulsions. Why do they engage in the compulsions? Typically to reduce the anxiety that they feel from the obsessions. All right. Now, there's tremendous diversity in terms of what types of obsessions, what types of compulsions people have. The one that gets depicted in movies and stuff all the time, that I see anyway, is hand washing, compulsive hand washing in response to obsessive thoughts about uncleanliness or the importance of hand washing or something. But there are other ways. There are other ways that this can manifest itself, and it's not the sort of thing that you can just tell a person, hey, stop doing that. Your behavior doesn't make sense to me. Stop exhibiting OCD. Usually they're going to need help. They're going to need help. Sometimes they need medication. Sometimes they respond well to medication. Other times they need things like behavior therapy. All right, but it's not something that someone can shut off, and it is absolutely not the same thing as just being neat and orderly. So people, if you are neat and orderly or like things just so, stop saying that you're OCD about that. It's kind of disrespectful to the people who actually have OCD. And another tricky thing is, when they were when they were classifying personality disorders, there is a personality disorder called obsessive compulsive personality disorder that is more in line with how people use the word, just liking things just so. But your obsessive compulsive disorder, that's not what that is. It is more severe, and it has these specific features of having the obsessions and the compulsions. All right, another anxiety disorder, and I'm going to go ahead and put it into this video instead of giving it its separate video, and that is post-traumatic stress disorder, often abbreviated PTSD. And you have to experience a trauma to develop this disorder. The trauma is based on how the person experiences it. One event may be traumatic for one person, but not for another, so we have to keep that in mind. Your perception of the event is that it is traumatic, and symptoms have to be present for more than 1 month and include the development of fear, anxiety, and other re-experiencing. All right, that's a key thing that you can see with PTSD: reliving, re-experiencing, having intrusive memories about the event in response to the traumatic experience. So something traumatic happens, and then in the future you are experiencing fear, anxiety, or reliving regarding that traumatic event. It sneaks back into your life is one way to think about it. Now, you can also have something called acute stress disorder, which is shorter term. This is more like a reaction to the trauma, to the event. So this is development of fear, anxiety, and other re-experiencing symptoms in response to a traumatic experience. But here's the difference. Symptoms last between 3 days and 1 month after the trauma. So acute stress is more like, this is recent, I'm still feeling it. PTSD is like, this is less recent, I am still being affected by this trauma. And like with any anxiety disorders, what we have is typically the need for therapy, possibly combined with medication, but addressing these behaviors. Because, for example, if somebody has PTSD, if you just tell them, hey, stop acting like that, they can't switch it off. All right, I bring these things up because sometimes students will ask questions, they will make comments in class, and these are classified as disorders because they cause problems for people. They don't just go away because the person would like them to go away. They cause problems, and very often they are persistent, intrusive in the person's life. All right, now that's it for anxiety disorders. We're not done though. Those are just the anxiety disorders. Next, we are going to start going over mood disorders or depressive disorders.